everyone. Thank you so much for joining us for this presentation of Beating COVID Burnout, Thriving Using the 4 Pillars of Wellness. As you all know, it's been over a year now since we've been having COVID in our everyday life. And frankly, we're tired of it. Hopefully, as we start to vaccinate people and getting a hand on things, we will all be having a better 2021. But for now, we'd like to help you learn some practical tips to stay well during this time. I am Dr. Rosie Canarella Lorenzetti. I'm a family doc and currently practicing in Shepherdstown. And our 2 speakers today are Jasmine Tharakan and Kara Bird, who are both 4th-year medical students in the track. They will be graduating as physicians May 16th to be one of our colleagues. The Culinary and Lifestyle Medicine track is very special and unique to WVU School of Medicine. It is the first track of its kind in the country, actually, where medical students chose to be in the track so that they could spend extra time during their 4 years of medical school learning about wellness, health promotion, and disease prevention. A lot of medical schools teach about disease identification and treatment, but these students have spent over 300 extra hours during their medical education learning how to keep patients well. These 4 pillars of wellness are nutrition, sleep, stress, and physical activity. We know that if these 4 pillars in your life are well balanced, that is, if you eat right and eat healthfully, and you get a good night's sleep and you wake up feeling refreshed, and you get an adequate amount of movement in your day, and lastly, learn how to handle stress well, you're going to be a healthy person. So in Jasmine and Kara's presentation, they're going to touch on each pillar. They're going to talk about some evidence-based information and then try to give you some very practical tips so that you can decide which one of these pillars that you want to improve in your life to stay well.
Good evening, everyone, and thank you so much for being with us today. It's an honor and privilege to be with you all. My name is Jasmine, and I am a 4th-year medical student at WVU, and I will be beginning my residency training in June in internal medicine at The Ohio State University. So as we get this presentation started, I first wanted to pause and reflect on what burnout is and what it looks like. So burnout is what happens when we reach our limits mentally, emotionally, and physically. And there are 3 key components. So the first component is physical and emotional exhaustion, where we feel emotionally drained, worn out, and not able to recover in our downtime. This is by far the most common symptom of burnout. The second component is depersonalization, and this is when we begin to develop a negative, callous, or cynical attitude towards other people that we interact with. And the third component is a reduced sense of personal accomplishment. And this is when we feel like the work that we're doing is beginning to feel meaningless, and we view our work negatively, and then we also start to begin to view ourselves as incompetent. So there are many drivers of burnout, and it's been really widely reported in literature. So professional demands coupled with personal stressors such as financial worries, limited free time, feeling like you're being pulled in so many different directions, isolation, and uncertainty can further compound burnout risk. So currently, as Dr. C mentioned, it's impossible to reflect on burnout without thinking about the potential impact of the COVID-19 pandemic. So the response to the COVID-19 pandemic is a marathon and not a sprint. But how can we take control in a world where we feel like so much is not really in our control? So resiliency is the antithesis of burnout. And so the goal of this discussion that Kara and I have is to begin thinking about how we can use the 4 pillars of wellness to rebuild and strengthen our resiliency. And one of the ways we can do that is something called SMART goals. And SMART goals is a widely used tool to help make our goals clear and reachable. So what does a SMART goal mean? So the S stands for specific. Your goal should be clear and individualized. So questions you might ask yourself include, what do I want to accomplish? Why is this goal important to me? Who's involved? Where is it located? And what resources do I need to accomplish this specific goal? The M stands for measurable. It's important to have measurable goals so that we can track our progress. Questions you might ask to make a measurable goal might be, how much of this or how many of this is needed? Number 3, A stands for attainable. Our goals should be realistic, should be achievable in order to be successful. R stands for relevant. Our goals should matter to us and be applicable to our current season of life. And lastly, the T stands for timely. A timely goal allows us to stay focused on a deadline and have something to work towards. So as Kara and I go through each pillar of health, we hope to share with you some examples of SMART goals and provide a platform to start healthy, small lifestyle modifications.
Hi, good evening. I'm Kara Bird. I'm a fourth-year medical student here at WVU, and I'll be continuing my residency in family medicine here at Harpers Ferry through WVU. So first, let's talk about stress. Right now, you might be like the character on the left with his mind full of a million things, stressed and worried. But maybe the things we talk about today can lead you to be more like the character on the right, whose mind full and able to enjoy the beautiful sunny day. So stress, we all have it. If we think back to middle school health class, we talked about eustress or good stress. It helps us finish projects on time, provides excitement for a first date, and pushes us to learn new skills that may later become a source of leisure. But when the scales are tipped and eustress turns into constant chronic stress, it can wear us down, burn us out, and make us sick. So, short-term and low-level stress is a necessary part of a successful life, but our bodies are not physiologically built to withstand long-term high levels of stress. We're built to run away from the bear in the woods once we hightailed it out of there to come back down to our baseline. So let's talk about how our body responds to an acute stressor. So say you see the lion, it's crouched in the savanna grasses, and immediately cortisol and adrenaline are going to be pumped into your bloodstream. It's fight, flight, or freeze. Our heart races to pump the blood as fast as possible to our muscles, and our blood pressure increases. Our muscles tense with the anticipation of our next move. Our liver pumps glucose into the blood because your muscles are going to need it to fight or run. Our gut slows down because no energy is going to be wasted on digesting those nuts and berries you just foraged. I don't know about you, but I'm going to be running, and after 10 to 15 minutes of knowing I'm not about to be somebody else's dinner, I calm down and everything goes back to normal. So herein lies the problem. We no longer have to run from a lion in the savannah, but in this world we live in, it's difficult to avoid chronic stressors. We work long hours in stressful jobs, or we've lost our job. We have ill parents to care for, or we're sick ourselves. The news makes it seem like the world might end tomorrow, and we've spent the last year dealing with the pandemic and being isolated, and the loneliness and the frustration that goes with that, and that list just goes on and on. So we unfortunately just weren't built to sustain this type of chronic stress. So let's go back to what we talked about in the last slide and how adrenaline and cortisol affect our body. So your heart rate goes up and your blood pressure goes up, and this is going to lead to conditions like heart disease and stroke. The cortisol and adrenaline cause our muscles to tense, and we stay tense. There's good evidence out there that a lot of our lower back pain is actually caused by chronic stress, and it's a known cause of headaches and migraines. The liver converts stored energy into glucose, and eventually all that glucose in the system leads to insulin insensitivity, which will eventually lead to things like diabetes. Our body also constantly thinks it needs to run at any minute, so we're storing that energy as fat, leading to obesity. Our gut slows down, further increasing our risk of obesity and causing other issues like abdominal pain, irritable bowel syndrome, and constipation. The body responds to chronic stress like it responds to chronic illness. This puts us at an increased risk of things like autoimmune disease and cancer. Studies have also linked chronic stress to things like eczema, menstrual irregularities, and infertility. And obviously, chronic stress is a major component of anxiety, depression, and insomnia. It's estimated that between 75 to 90% of primary care visits are actually stress-related. So I ask you to think of yourself as an athlete. Marathoners don't finish the race and then head back to the gym. They're going to recover after an event like that, and you need time to recover too. So you have to think about what you can do for you, what brings you peace, what makes you feel refreshed. So sometimes we have this stress hovering over us. It's just this nagging anxiety in the back of our minds, but we don't really explore it because of time restraints or avoidance as a coping mechanism. So I challenge you to really think about what your source of stress is. Make a list. Are there things on that list that can be resolved or cut out of your life? Is it social media that's making you unhappy? Is it a lingering deadline, a toxic relationship? Whatever it might be, how can you limit your stressors and spend more time focusing on the good? So making a goal doesn't have to be drastic, it just has to be smart. So maybe for you that would be, exploring those stressors, finding out what it really is that's stressing you out, forgiving yourself, saying no and setting boundaries, asking for what you need. If you don't ask for something, you're not likely to get it. Make time for a hobby. Studies show that people who have a dedicated hobby have higher levels of reported happiness and lower levels of stress. Get off social media. Comparing yourself to somebody else's overly filtered and superficially perfect life that they piece together in pictures sets impossible standards for anybody. Meditate. Evaluate your coping mechanisms. Are you overeating? Are you drinking too much alcohol? Is it procrastination that's stressing you out? Get enough sleep and exercise, which leads us into our next pillar of health. So let's talk about exercise. Our bodies were designed to move. As we all know, a sedentary lifestyle is a risk factor for many chronic diseases, and physical fitness is associated with lower mortality risk from any cause. Even Hippocrates in 400 BC said that walking is a man's best medicine, so the benefits of physical activity to health have long been recognized. This isn't news. So studies show that exercise is a more effective treatment than drugs in many cases. One study found that exercise and drug interventions were equally as effective in prevention of coronary heart disease and the progression of prediabetes to full-blown diabetes. For patients with a history of stroke, physical activity interventions were actually even more effective than drug treatment. Unlike drugs, exercise has no risks or no side effects, and it provides many other benefits as well. So we all know the benefits of exercise are numerous, but just to name a few, increased quality of life. Studies show that the higher intensity of the exercise, the higher participants rated their quality of life. Better cognitive function, higher quality of sleep, improved mood and decreased stress levels. There's been consistent findings that people report feeling calmer after 20 to 30 minutes of aerobic exercise, and the calming effect can last hours after the exercise. Others, better control of chronic health conditions, everything from peripheral artery disease to managing menopause symptoms. So how much exercise do we really need? The American Heart Association recommends at least 30 minutes of moderate intensity aerobic activity 5 days a week, or at least 25 minutes of vigorous aerobic activity at least 3 days a week, plus a moderate to high intensity muscle strengthening activity at least 2 days a week. So this, you don't have to start here. This is just a goal to work towards. So what do these exercise intensities mean? What defines low, moderate, or vigorous exercise? So low intensity exercise, you should easily be able to carry on a conversation or sing a song like Happy Birthday. Moderate exercise, you're not able to sing without taking a break. And in vigorous intensity exercise, you're unable to say more than a few words at a time without taking a breath. So what are some examples of moderate exercise? Those include brisk walking, like walking 2 miles in 30 minutes, or riding a bike, like 5 miles in 30 minutes. Just things around the house, like pushing a lawnmower, raking leaves, gardening, vacuuming, or mopping. So some examples of vigorous exercise include running or jogging in place, brisk cycling, swimming laps, squats and lunges. You can do that with or without dumbbells, running up a flight of stairs, heavy yard work like continuous shoveling or hoeing, and calisthenics such as push-ups, mountain climbers, or jumping jacks. So I know many of our patients have limited mobility, and maybe you're thinking, I just can't exercise. My knees, I have knee pain, I have hip pain. It prevents me from doing a lot of things I want to do. But there are things you can do even just around the house. You don't have to go to the gym to do these. So things like just taking a walk or a lap between commercial breaks of your show, doing armchair exercises. If you have access to a pool, water aerobics are fantastic exercise. Doing sitting leg lifts, gentle chair yoga, or things like Tai Chi. So exercise, where can you start? How can you start exercising? Just remember that all movement counts. And a good place to start is something achievable, like doing 5 1-minute high-intensity exercises every day. And doing this just once a day, you'll meet half the weekly recommendation of 75 minutes vigorous exercise per week. Other helpful ideas are doing things like keeping a daily log of exercise sessions to track progress. Maybe you can find a workout buddy to help motivate you. Taking the stairs instead of taking the elevator. Tracking your steps with an iPhone or watches are really great for that these days. Or trying one new workout a month. Okay, so now I'll pass it off back to Jasmine. She can talk to you about nutrition.
So the next pillar of health is nutrition, and there are so many different topics that can be discussed with nutrition, and I could probably spend hours and hours talking about the various different components of nutrition, but I'm sure you don't want to hear all about that. So today, I would like to focus on a specific topic that I know I personally struggle with when I experience burnout, and especially experience during the quarantine, and that's stress eating. So stress is a challenge to our body's natural homeostasis. So in response, our bodies produce a physiologic response to regain this balance. And we can correlate this with feeding behavior. Dietary choice research has demonstrated that people often use food to maintain emotional equilibrium. And so just as Kara previously explained, when we go through acute stress, our bodies release epinephrine, otherwise known as adrenaline, and this causes that fight or flight response. And so that's why oftentimes when people undergo acute stress, you may feel a reduction in hunger. But what ends up happening is repeated bouts of daily stressors leads to the stress system in a chronically activated state, which leads to persistently elevated levels of cortisol. And like how Kara mentioned, there's so many different things that cortisol does to our bodies, but one of them is it's a hormone that can stimulate our hunger and motivation. So with these persistently elevated levels of cortisol, we can even end up altering some of our brain reward and motivation pathways involved in feeding behavior and actually lead to induction of metabolic changes that can increase our body fat mass. So I'm sure as you've noticed from your personal experience as well as mine that the foods eaten during times of stress typically favor hyperpalatable, otherwise known as these comfort foods, such as fast food or snacks or calorie-dense foods, even in the absence of hunger. This has especially been noted in animal models. So the reason why I bring all this up is because it's not just in our minds, it's a real reaction happening in our bodies. So how do we fight this? And one of the ways that we can fight this is through something called mindfulness. So mindfulness is the intentional accepting and non-judgmental focus of one's attention on the emotions, thoughts, and sensations occurring in the present moment. So what does this look like? So for you, it might be not overeating or stop eating when you're feeling full. What does this look like? So in order to focus on one's attention during the meal, it's important to disengage from any distractions such as TV, computer, or your phone. Focusing on the meal allows you to experience your hunger and your fullness more completely. I know that when I'm watching TV and if I have a bag of chips around, before I realize it, all of the chips are gone, and that's one way that I'm being mindless, because as you're watching, you're not really mindfully eating. So that might be one way that you can focus on a healthy eating habit. Other ways is doing a hunger reality check. When you do feel hungry, taking a pause and reflecting on how you're feeling. Do you feel hungry because you need to feel nourished? Do you feel hungry because you're avoiding something, or you feel incredibly stressed, or you're excited about something? Another way is meeting our emotional needs in new alternate ways. And what does that look like? As Kara mentioned before, maybe having a hobby or having something to turn to when you do feel that you need to eat but you aren't truly hungry. Maybe it might be keeping a food diary or an app, and it might not be doing a food diary for all of your meals. Maybe it could just be keeping a log of when you snack and what you are snacking on. Because sometimes we may not be even recognizing that there are certain patterns that we have in our day-to-day lives. Another key component of trying to eat healthy is hydration. Oftentimes our bodies can't recognize when we're hungry or if we're thirsty. And when we do feel really hungry, it might be because we're dehydrated. Hydration is very, very important. And another option is choosing healthy alternatives when snacking. So what does that look like? So we do know that antioxidant foods help with inflammation. And so these include your veggies, your green leafy veggies, your whole grains, nuts like almonds and walnuts and spices. And something I really want to draw upon is good healthy fats and protein. Why is that important when we think about stress eating and we think about burnout? Is when we add healthy fats to our diet and we add protein to our diet, it's going to help with our satiety, our feeling of fullness, and it can decrease our cravings. Another important aspect of having good healthy fats and protein in our diet is that it helps maintain our blood sugars within an appropriate range. So if you look at this graph, I really like this graph because of the way it depicts how different foods affect our blood sugar levels, which can trigger an insulin spike. So what ends up happening is, let's say we have a bowl of cereal, and we eat the bowl of cereal, and there's sugar released into our blood. And in response to that, our pancreas produces a hormone called insulin. And insulin's goal is to take all that sugar that it's seeing in the blood, otherwise known as glucose, and distribute it to various portions of our body so that the glucose levels, our sugar levels within our blood, are within a normal range. Constant swings in our insulin has been correlated with decreased mood and increased irritability, otherwise known as feeling hangry. So if you look at the red line, you can see when we have sugary foods, we have a steep spike in our glucose followed by a steep spike in our insulin. If we add proteins and healthy fats or more whole grains, fruits, and veggies, it's not that we're not having any sugars in our bodies, but it's that we're decreasing its absorption, so we're not having as much of a spike in our glucose and as much of a spike in our insulin. Our goal is to minimize excess insulin release. And that might be, instead of just having an apple, you might have apple with a nut butter. Or instead of having just toast in the morning, you might have a toast and eggs. So nutrition, where do we start? So for you, in this season of your life, you might say, I'm ready to make some changes with regards to nutrition. So maybe that might be restocking your pantry with healthier snack options. Maybe it might be for the next 2 weeks or the next month, you're going to choose to, instead of drinking your calories with sodas or juice, you might choose water or fruit-infused water. Maybe for you, it might be for the next month, I'm going to choose to stop eating 2 hours before I go to sleep. For you, you might just want to start with, I'm just going to keep track of my food and see what habits that I may not be consciously aware of that I have. For you, it might be monitoring your portion size. You might say for the next month or so, when I do watch TV and I'm going to have a snack, instead of taking the whole bag with me, I'm going to look at the nutrition label and see what a portion size is, and I'm only going to take that portion. And then afterwards, when I still feel hungry, I'm going to go back and get another. For you, it just might be I'm going to practice mindful eating. When I do feel hungry, when I do feel like I'm stressed and I need to go for that extra chocolate bar, I might pause and reflect. How do I feel right now? Do I feel stressed? Do I feel thirsty? Or am I really hungry because I need to feel nourished? So the next pillar of health is sleep. And sleep is one of the most powerful tools we have to strengthen our wellness. And the true power of sleep is often underestimated. So the power of sleep. According to the CDC, 1 in 3 adults don't get enough sleep. And lack of sleep is linked to several medical conditions, including type 2 diabetes, heart disease, obesity, and depression. So that's why when you maybe go to your primary care physician and you have diabetes or you have hypertension, they often ask, how well do you sleep? Because more often than we think, sleep plays such an important role in how our bodies react to stress and our wellness. But the interesting thing with talking about burnout and talking about sleep is that the symptoms often overlap. Mood changes, increased sleepiness, fatigue, irritability, difficulty concentrating, disorientation. We can feel that when we feel burned out, but we can also feel that when we're sleep deprived. So there is a strong connection between sleep and burnout, and oftentimes the connection really isn't just black and white. So sleep deprivation can lead to that hyperarousal state and the inability to settle down due to our worries or concerns or anxiety. For you, this might look like falling asleep, but you feel like your mind is constantly spinning. So all these factors lead to difficulty with both sleep initiation and sleep maintenance. And so this leads to inefficient sleep quality and leads to the underlying cyclical dilemma of sleep disturbance and its role in burnout. And so as Kara mentioned earlier about stress and the implications it has to our bodies and the cortisol levels, not only can we see that with sleep deprivation, we can see that with burnout as well. So chronic stress are mediators of both burnout and sleep deprivation. So how much sleep do we need? Everyone's individual sleep needs may vary, but in general, most healthy adults are built for 16 hours of wakefulness and an average of 8 hours of sleep. Some individuals can get away with less than that and still feel nourished, and some need even 10 hours to feel fully nourished. So the takeaway is, although there is some genetic variation, most adults need between 7.5 and 8.5 hours of sleep to function optimally. So you can find your optimal sleep time if you set aside several days to allow yourself to sleep as long as possible. Once you know how much sleep you do need, it's important to allot that amount of time in your daily schedule for sleep. So where do I start? So some of you may be thinking to yourself, well, I really want to work on sleep, but whenever I do lie in bed, my mind is racing and thinking about so many different things, and I can't seem to press the off button. So what do I do? And I want to reassure you that when we focus on sleep, the changes aren't going to happen overnight, but the key is consistency. So for you, it might be, I'm going to start off with in the next 2 weeks or in the next month, I'm just going to log when I'm falling asleep, when I'm waking up, how long I'm sleeping for. Or for you, it might be, I am ready in this season of life to start a consistent sleep schedule, trying to go to bed at the exact same time every single night, including weekends. Maybe for you, it might be, I'm going to try to keep my bedroom quiet, comfortable, and in a comfortable temperature. For you, it might be for the next 2 weeks or 3 weeks, I'm going to try to set aside my phone a half hour before I fall asleep. Or it might be that you're ready to start a pre-sleep bedtime routine, grounded meditation, or using an app to calm your nerves and help you fall asleep. And so, like I mentioned before, these are some helpful apps that Kara and I have found useful, and these might be a great place for you to start as you create these lifestyle modifications. And this is also, you don't have to feel like exercise is expensive, and there's a lot of opportunities in Berkeley County as well, and in Jefferson County for exercise. So these are some really great examples. So, we hope that after this discussion, you feel motivated to make some lifestyle modifications and at least one pillar of health. Maybe in this season of your life, you're ready to make some changes with the pillar of health of sleep or with stress. We hope that you have the building blocks to make some SMART goals that are specific and relevant to your personal life. And we encourage you to share your goals with a loved one or even with your primary care physician. This way, people can journey alongside of you and be your accountability partner. Life is so much easier when you have people rooting for you. So thriving using the 4 pillars of health doesn't mean that all of a sudden all the stress in life will go away. But we hope that the pillars of health build your resiliency. Achieving one small goal will lead to making more small, tangible goals, which can lead to long-term lifestyle modifications. And always remember to show yourself grace as you reach your goals. We thank you so much for spending some time with us this evening, and we look forward to hearing your stories of wellness. Thank you.